Okay, and so now we have the pleasure to sit down with Mr. Yasir Niazi, who's the Managing Director here. Thank you so much for taking out the time and talking to us today.
Thank you very much for having me on your program.
Well, I'm sure that, you know, the conversation we had before we started recording, that was so enlightening to me because we touched upon different parts of the healthcare system that people usually don't talk about. And what I thought was very, very interesting was your own profile. I thought, you know, your whole story of how you got into this profession and the steps that led you to it. Please tell us about that.
Yeah, it's very unique. In fact, it is that I'm not a doctor. I'm an engineer by education.
Okay.
And I never wanted to become a doctor. And hospital is something which I wanted to stay away from. I never enjoyed it. Right. But the faith and has brought me here.
Yeah.
But once I got engaged into this, I realized that how much I can help the humanity being part of this. And now I'm very thankful that I got the opportunity to be part of this, not only in the hospital setting where we are trying to help the humanity and the suffering of the people, but also with the students, where every student who walks in, the hope, the dreams in their eyes, and been able to be part of it, be able to help them, to nurture them, to teach them, to mentor them. I think this is a feeling which has kept me here and kept me going so far, and that's what helps me get up every morning.
The human element, and that's something that, you know, when a person is running an organization, anything, a company, a hospital, it has its own demands. So to be able to think of a student and what their you know, interests are and what is good for them, that is something that is unique as well. So I would say that you would have a high EQ, emotional quotient, emotional intelligence.
You can't, working with the patients as well as students, you can't help other than being an emotional person and humanity. As Islamabad Medical and Dental College, our motto is to providing base to serve humanity. The humanity and serving of the humanity is in our DNA. And because we are dealing with students, the future of Pakistan, the future of healthcare in Pakistan, as well as the patients and these things, we can't help not be emotional. And this is, I think, what makes us unique and different, is that we have the emotional relation and emotional link to our patients as well as our students.
That's something as well that I would say is very, very important. The, you know, the conscious effort to make sure that a patient is well cared for and well looked after, because unfortunately in our part of the world we do have instances where there are many grievances from patients who have had medical care and they're not happy with the way they've been treated. How do you take that one step further?
This is what we teach our students. That's the basic what we tell them. We tell them the person who's in front of you, he's a human being first and patient second. Don't view him as a patient only. View him as a human being. View him as somebody's mother, father. View him as somebody's brother and sister, or view him as somebody's son or daughter. And treat them like you treat your own. So humanity is in the core of our teaching philosophy here, and in our core of our service-based. We always say at Akbar Niazi Teaching Hospital, patient comes first. And that's what matters for us, and that's what we want to work with.
Now that's fantastic, and it's so refreshing to hear that, you know, the human angle is very, very you know, prominent here in your hospital. That's fantastic. Now your hospital has a unique location as well. Tell me about the patients that you see here and what services are provided.
We are very proud of our location. We chose this. We wanted to be at the outskirts of it. Two reasons. Although this is part of Islamabad Capital Territory area, but it had the lowest bed to population ratio. This is a ratio which globally is used to gauge the quality and availability of healthcare in any region. So we picked this is because it had the lowest bed to population ratio as to any area in Pakistan. although we are so close to Islamabad. So we picked that. Our encatchment area is very, very unique. We serve all the way to Muzaffarabad, Kashmir, and to Galiat, and all the way to Abbottabad on one end, and to the north of Punjab on the other side. And that's what makes us very unique and gives us a very diverse kind of a patient body which we get. We also have very much access now because of our reputation we have built in and the quality of service we are providing. We are getting patients now from outside Islamabad region, also from a majority. Now we're getting a lot of patients from KPK and also from the north and south of Punjab.
And that's all because of word of mouth, because people who have been here, who have, you know, had the feel of the hospital, and as you said, the motto that you have here of being humans first. So basically everybody is looking for that.
Exactly.
You know, even they can get the best healthcare, but if it is without compassion, then they will feel that something's missing. Because, you know, when we talk about bedside manner as well, a doctor who will come up to you and will smile, and, you know, you often get patients who say, you know, Doctor Sahab aap se milke aadhi bimari khatam ho gayi hai, and things like that. So that's how important the bedside manner is. And I'm so happy that you insist on that here.
It's very much, and we believe in that. We believe that 80% of the cure is the patient, it's the doctor's behavior and the relationship between doctor and patient. Because the patient, you can give him all the medicine you want, but if he doesn't trust the patient, the doctor, the patient will not react to the treatment. And that's why it's so important to build that relationship of trust between the patient and doctor, so the patient can react to the treatment which is being provided to him.
That is such an important point there, because then you reach a barrier where they can't cross that barrier. It's so important. Okay, what about patients who are, you know, they can't afford the proper health care, and they're, well, you know, inflation being what it is, and things are getting even more difficult for people to have basic health care. How do you help them? What services are available here?
We are very unique in that concept. We have built in, Akbar Niazi Teaching Hospital was formed with a philosophy of providing the best value at the best price. We pride ourselves on giving the best value, and that's what we work in. Our philosophy at Akbar Niazi Teaching Hospital is quality, standardized, international care at an affordable price, where we want the patient to be able to afford healthcare with a respect, and that's what it is. Another thing which we do is our emergency services. It's also it works on a zero refusal basis. We do not refuse anybody any service if they cannot afford. We have inbuilt system where we have a certain percentage of value or the revenues go towards a fund to fund the necessary one. So if you come into Akbar Niazi Teaching Hospital and you cannot afford this, you will not be refused service in these things. You only have to ask, and that's what's going to happen. And especially in our emergency, where we get a lot of road accident, because we are on one of the main arteries here in Islamabad, linking to Kashmir, Murray, and all the tourist areas. So we have made a philosophy here, which is zero refusal. We do not refuse service if you cannot afford.
That is really amazing.
Yes.
Yeah, and I'm sure that people who are listening to this will be, you know, it's so heartwarming to know of these things, especially, as I mentioned before, with inflation getting as it is and people having less and less money to spend on themselves when it comes to regarding their health issues. So that is great.
It's a huge challenge. I'm glad you brought it up, because the thing is, before this national health program or the insurance program we had, the Sehat Suhulat program we had, 80% of Pakistanis were spending out of pocket for their health care. That's why for us to have universal insurance, or to have insurance scheme or kind of a protection for the patient is indeed very important. And we cannot develop healthcare in Pakistan without having a program like this.
Right, okay. Tell us about the various training programs that are going on here in your hospital.
Well, this is teaching hospital, and it's in our name, and that's what we do. We have undergrad programs. We have 3 undergrad programs. One is an MBBS program. The other one is for BDS, which is for the dental doctors. Then we have BSN, Bachelors of Nursing. Then we have Bachelors in Medical Technology, Lab Technology, where we train the lab technicians. This is 4-year degrees, it's a bachelor's degree. And then we have Doctor of Physiotherapy, again a 5-year program, which we have, we train students here. Beyond that, we have post-graduation specialization program. We have around 7 programs in our dental section, and we have 6 programs at our medical section here. And we are offering post-graduation also in master's degree, as well as the fellowship with College of Physicians and Surgeons.
When we were speaking earlier, you mentioned that graduation is a happy and a sad occasion. Can you please elaborate on that?
Oh, it is. You know, it's a very joyous occasion, but at the same time, it makes us a little sad. It's a joy and happy occasion because we see the people who came in with us, and we nurtured them, we developed them, we taught them, we mentored them, and to see them become who they are as successful doctors and graduate and move on to the next phase of their life. But at the same time, we get so attached to them over 5 years. They become our own. And when they leave, there's a certain sadness to it also, to see them move away and go on. But we have to, like any other things, we have to make ourselves accept this fact that they are moving on to the better and a mission in their life and a better position in their life.
Have you had any stories where your students have come back to you with success stories or things like that they wanted to share with you?
Oh, many. We have very much students who have gone abroad. They have completed their post-graduation and they're coming back to, and they want to work and serve at their mother institution, as well as we have students who have moved on to the armed services and providing service to the nation through the medical services and the armed services. They come back, and when we see them having the ranks on their shoulders, being proud, wearing that uniform, it makes us proud also. And majority of students, they come back and do their post-graduation with us also.
Oh,
because
wonderful.
that is the relationship we built. They own their institution, and we are very proud that they own this institution, and they want to be part of it for a longer period.
And that's a success story in itself for them coming
is.
back to you after being abroad and getting their training from abroad.
Definitely.
Yeah,
Definitely.
okay.
We really pride ourselves on that.
Great. You also received an Excellence Award. The hospital received it from the ICCI. Tell us about that, and what, in your view, is excellence?
Excellence, we are very much thankful to the Islamabad Chamber of Commerce for recognizing our contribution to the healthcare in Pakistan and giving us this award. And we feel that this is a part of a journey we have to get in. For me, excellence is never achieved. It's a journey. It's a struggle. We have to keep on working towards and achieving excellence. We have to innovate ourselves. We have to develop ourselves. We need to reinvent ourselves. We need to make ourselves more attuned to the international standards and what's happening in terms of development around the world. We have to adopt new technology and bring it here. We have to be in the top in terms of innovation. We have to do research and create these things. That's all combination of that will get you on the journey of excellence, but not the destination.
That's very interesting, because there is a danger of achieving some level of excellence or being recognized as excellent for a person to become complacent and sort of think that, okay, great, now we've reached this level, now we can sort of step back a bit. But you say that no, that's the time for you to work harder.
The only constant here at Akbar Niazi Teaching Hospital and IMDC is innovation and change.
Right.
We will have to rethink everything we do on a daily basis. If we do something good, we have to find a way to do it better. If you're doing something better, we need to find it how to do it the best way to this. That's the philosophy we work on. That's why we keep on innovating, we keep on rediscovering ourselves, and that is a mission, what we work with.
Right. How is the innovation taking place? Through what mediums?
We have different mediums. We have a faculty development program where we continuously develop our faculty. We have international speakers forum where we work with international forums, speakers. We bring them here to introduce us with modern techniques. We work with the manufacturers of different technology, introduction, to introduce our students as well as our doctors on the new techniques. We have international tours where we take our faculty and our students globally so they can see what is happening around the world. At the same time, we have what we call the visiting faculty program, where we have international faculty who comes in, they teach, not only teach our students, but at the same time they introduce new techniques to our faculties and the consultants. We have international collaborations with the international hospitals across the world. We have collaboration with Anhui University in China, with Capital University in China, as well as a couple of universities in Turkey, as well as in Germany and United States, where we are working with different institutions. And that's why student exchange, faculty exchange, ideas, and we keep on innovating and refreshing ourselves and knowing what the rest of the world is doing. Not only that we learn, we teach the world also. There are a lot of things which we can contribute to these international forums also. It's not a one-way street. We represent Pakistan and Pakistan healthcare industries through the international forum through these techniques also. And that's what we are building, act as an ambassadors of Pakistan to the global healthcare industry.
That is so important, everything that you said. And what you're actually doing is you're taking the classroom out of the class, you're taking the students out of theory and you're putting them in a practical setting.
Yes, it is very important. I'm glad you bring it up because that's how our undergraduate curriculum is built also. We introduce clinical studies from year one. Our students get exposed to clinical work from the very beginning. And we keep on taking him to the environment where eventually he's going to be working in. And it's very much practical and skill-driven curriculum rather than only theoretical.
Which again, you know, is the emphasis could not be more that how much this teaches you, because it is the hands-on experience that actually takes a person further in their, you know, like I would say, their journey to excellence, as we spoke.
And it brings them closer to the patient again as soon as possible. So it's not the theory and then they go to the patient. The sooner we get them to interact with the patient, the more responsive and the better they respond to the patient as a human being.
What feedback do you get from patients once they've been here, they've had this experience at your hospital? What feedback do you have? What do they have to say?
We have many success stories. We have very much satisfied patients, but again, it's a journey. You know, we can't. There is always room for improvement, and we always look at every feedback we get from our patient as constructive feedback. It's a feedback which help us improve ourselves, to grow ourselves and develop. So we always welcome feedback from our patients, and it's a very important, makes a very important part of our growth process. We have a portal where we encourage patients to give us feedback. We have ambassadors, students who go back and over to the patients when they're discharged and they interview them and ask them how was their experience, what would they like more or less, what would they liked, what they didn't like, and what they can help us improve. Because if we don't take that feedback and we get into this that we are doing a perfect job, we are not going to improve. So for us, this patient feedback is very key element of our growth.
And positivity is infectious, is it not?
Yes. We try to be positive. We want to take everything with a high stride, and that's what, because we are in a profession where it's very easy to get bogged down because there's suffering around, there's people who are in pain. If we don't have this positive energy that we need to help them out, we cannot help patients and we can't transfer this positivity. We hope that this positivity is transferred to our patients and we can make their life better.
Right. In the years that we faced COVID and the change that it impacted on people, on their lifestyles, on their well-being, the way they think, emotional, mental, physical, all these things, that financial as well, that came together. How did it affect your hospital? And what is your view on how we are dealing with the aftermath of COVID as well?
I believe that COVID changed healthcare and how the hospitals are going to operate. I think COVID has laid down a foundation of how the healthcare process will be viewed in the future. I think the role of hospitals over the time will be declining, and there will be less. We will be going more towards home care and more towards virtual, as well as connectivity, and providing healthcare to the patient at the doorstep through the connectivity, through the different application, through virtual clinics and things like that. But COVID was a very difficult profession at the time. Yeah. It was a difficult time for everybody, but especially for the healthcare workers. They were the frontline warriors. Oh, yeah. Because not only they were putting their own life at risk on a disease which we did not know much about, and still we don't know a lot about. But by being there in the hospital, helping the patient, they were putting their families at risk also. And that's why we came up with we coined the terms COVID heroes. And our students, our young doctors, our senior doctors, they all came up and stepped up. One of the unique things which Akbar Niazi Teaching Hospital had during the COVID, we did not shut down our doors for a single day. We kept on providing service to the Pakistan, to the Islamabad and capital area, as well as the surrounding area, every day of the time, and our doctors never refused. And this all credit goes to our healthcare workers, from the doctors to the nurses to the paramedics to the sanitary workers. They all came to us and they said, we want to serve, and we want to serve today. And we were at the fourth step. We did not only follow what the NCOC was telling us, we led the way. We innovated, we provided the maximum number of oxygenated beds in the area, and we were always there at the forefront. We introduced and developed with ventilators provided at the service to the government, and we said it is available there. And
this was produced where?
Here, in our hospital. We gave them the provision. We developed, we stayed ahead of the disease. We created the concept of multidisciplinary team, where we had we used to have teams from US, UK and Pakistan sit together and collaborate on how the patient was. Every patient, because every patient had a unique pattern and was presenting with a unique pattern of disease. So we would discuss that in those teams, in virtual teams, teams sitting in UK, US and Pakistan, and we will discuss the patients, and we will come up with solution to this. One of the things is we pride ourselves is that in Islamabad, Rawalpindi area, we had one of the lowest morbidity and mortality rate. And most of our patients, not as much as we would have liked, but most of our patients, we were able to send them back happy to their families. And that's what makes it. Another challenge which COVID has brought in is mental health. I think it has changed the way we behave. It has introduced paranoia in our life, and a lot of other mental diseases, not only for our students, because being offline classes, online classes, changes, uncertainty, the patients, the tension with the patients, not knowing, the families who had sick, admitted patients, the things they were going through.
So many people going through PTSD because of loved ones they had lost.
And everything. And then the stress on the healthcare workers. I think this should be our focus for next community. Normalization of the society from mental point of view, from psychological point of view. We are working very hard with our students. We have created special counseling cells. We are providing special counseling to our students as well as our doctors and healthcare workers and nurses in that point of view. And we are trying to rehabilitate them into normal life again. It's a long process. And what we see, we request the government and the regulators at the same time that this can be done. Yes, we are doing it on our own, but we need to make it a national issue and work on the mental and psychological health of the nation post-COVID and try to bring back the normalization as much as we can.
To make this a national priority.
Yes.
Yes, that's very astute. You've talked about the awareness programs. You've talked about how much you're educating your students, you know, beyond the classroom. How about educating patients that come in and that maybe might have had a bad experience somewhere else? How are they reassured?
See, we at Akbar Niazi Teaching Hospital, although we are a hospital, but we always tell them that prevention is better than cure. And we need to prevent disease rather than cure it. And that's our philosophy, and we want to work on this. And for that, we have programs. We go into the communities, we raise awareness, seasonal diseases and things like that. We have teams which go out. We have school program where we go to different schools. Our students and faculty has adopted more than 350 schools across Islamabad, where we go into these schools at different times. We not only monitor their nutrition and their growth and mental and physical growth, and also by creating an awareness and making those students ambassadors to their own communities and they go and work. Whereas the patients who come in and they have experiences or of trauma or they have bad experiences, we evaluate every patient psychologically and also. And whenever we feel that there needs to be an intervention, we provide that intervention free of cost to the patients, and it's available. Our psychological and psychiatry clinic is one of those free of cost clinics which we provide, and we encourage other doctors, if they see signs, to refer that for not necessary treatment, but to see, evaluate and counsel and give them the hope and these things. We also have a full-time psychologist available for the families, especially in our emergency services. We have a counseling room. So breaking the bad news when we do this and we feel like the families need counseling, that counseling is provided on site free of cost to the families who go through that trauma.
Are you happy that is a huge amount of work that is being done, by the way, because as you said, with your forward thinking and doing something, it's part of your prevention is better than cure, because it's all about mindset. So you're sort of like taking the bull by the horns and you're dealing with a problem, you're trying to deal with the problem before it has evolved and
Absolutely.
has surfaced.
Because you know, if you look at the healthcare pattern, psychological is sometimes it's what causes the disease. So if you help them psychologically to cope up, they respond better to the treatment, and that's what we work on towards.
Are you happy with the media? Do you think it is placing enough importance? So from that smile, I anticipate this answer right now. Are they doing enough to bring awareness to this very, very important issue that we have in Pakistan?
I wish they can do more, especially the mental health. I think we have too much bad news on our media.
Too much politics.
Too much politics. I think we need to talk about good things also.
I agree with you.
It's not that, and we are too much focused with politics and what's happening. There's so much else happening in Pakistan.
That's very
Pakistan is land of opportunities, it's land of beautiful people, it's land of beautiful places. And there are a lot of people doing very small things but very beneficial things.
The unsung heroes.
Unsung heroes. I think we need to talk about it, and especially when it comes to healthcare. I think media can play more into us creating the awareness and the prevention. If somebody gets sick in a family, it's a huge financial burden on that family.
Especially if they're the head of the family.
The head of the family. And we need to, media needs to realize that. I think we are available. We make ourselves available free of cost, and there have been enormous opportunities where I went on and I told the media is, if you want to develop any program on healthcare, we are available free of cost for consultancies, our consultants, and whatever you need in terms of information, in terms of research, in front of data, in terms of material, content, we can provide you that and make everybody available to you. Whatever resources we have made it available to the media, and so they can use that. I think there is a research also by Gallup and other research agencies telling about that 80% of our content is politics, and only 20% is lifestyle. I think we need to make it balanced, and it needs to be 50-50 and others. And I commend a program, PTV, for having a program like this and creating awareness about health services, what services are available to patient, if in case they suffer, where they can go to get the best services to them or best treatment, and that goes a long way in creating a healthy Pakistan.
That is so true, because right now, listening to this program, talking and sitting down with you, I have learnt so many new things. I have found out about so many new things that your hospital has to offer. People who are watching, they will find out, you know, about the free counselling services that you have, about the emergency that you said, that we don't turn anyone away. These things are so important, and then you have the trickle effect, because somebody else will be watching this who is in a position to do so, and they will think, okay, this all makes sense, and we should adopt these measures as well. And it's like the domino effect.
I hope it's contagious.
Yeah, that's a good word to use.
And that's what we want to be. We want to be agents of change.
Yeah.
We have brought in concept, and we want this concept to roll on. We will be expanding we want to expand our network and providing these things. We are taking this concept of value volume proposition of healthcare, where affordable healthcare concept, to the other cities. And one thing we are doing is we are not going to any major cities. You're not going to find another Akbar Niazi teaching hospital in Pindi or Lahore and all this stuff. You will find Akbar Niazi teaching hospital in Mia Valley, in Bakhar, in Rawat, and areas like that. And that's where we want to go. And we want to have, we talked about technology and virtuality. We want to have that linkage where we provide a low cost but a quality international standard healthcare to the patient at their doorstep.
Okay, how will you overcome the barriers of people, you know, who are so attuned to the physical aspect of healthcare, going in and seeing a doctor and talking to them, and then, so how will you overcome that barrier?
Very good question. Initially what we are doing is hybrid, where we have physical presence with virtual presence, and we train the patient slowly to start trusting the virtual one. If you go and we tried giving them directly the virtual one, yes, there is a lack of, I'm talking to a screen, can he understand on that or not? What we do is our first visit is physical, and then we try to have a follow-up visit through the virtual one. So he's sitting at home, we just have to ask, have you checked what's your blood pressure today? Have you taken your medicine? What is your symptoms? Is the medicine responding or not? And then we decide whether he needs to come and revisit the hospital or the doctor again. And that's how we work with the patient, where we are training the patient slowly and steadily. Yes, it's not revolutionary. It's an evolutionary process which is going to happen, but it's honest upon us as a healthcare provider to train the patient in that direction, because it is where we get cheap, affordable healthcare at the doorstep to the patients.
So, I'm amazed at your vision, honestly. It's so refreshing to sit down with someone who has such a great vision. And we were talking about training, and we would love to see the training college. And if you could take us around there and show us, if we could see some of the things that you were talking about.
Sure, we would love to do.
Let's go. Right, so this is the library, and although we're meant to, I can see the keep silence, but we can't keep silent here right now. So these are the books you have, and I can see a help desk as well. So tell me about the library and how it's helping
This
students.
is basically the learning resource center. That's where our reference books are. And we have also access to the research journals through our HEC library and connectivity. And we have and we keep on adding books to this library. And it's again, libraries are built over centuries.
Oh, that's a wonderful thought.
It's not an overnight. You can't create a library overnight. It's the books which keep on coming. It's the archives. It's the old books which you keep on adding. And as you progress and as your institution progress, the library is the main center. The quality of your library determines the quality of your institution and how much depth of knowledge is there. And what we would love to see one day here is our own students writing books and having their theses, their research papers. And we do have a research journal where our students publish their research in that. There's a student section of it, and as well as the faculty one also, and we publish that every quarterly. And our students participate very actively these things, because research is part of our student development also. We like to introduce them as early as possible into the culture of research and asking questions. And that's what develops us, and that's where these references come in. This is where
this is all happening then. This is very happening, even though it's silence. It's a very happening place.
Exactly.
Okay, I can see nursing. And you told me about the nursing training here and the nursing and patient relationship, how that's being worked upon. Tell us about that aspect.
Nursing is very important for healthcare because patient care is nursing care. Doctors are there to provide treatment, but the hospitals are built around nursing care because the quality of care in the hospital is all about the quality of nursing it provides. But unfortunately, it's one of those neglected areas when it comes to academics and development in Pakistan. I think we, as a healthcare industry, we have not focused on developing nurses and improving the quality of nursing in Pakistan. It has been always looked as a secondary profession in healthcare rather than primary healthcare giver. The world has moved on to the practitioner nurses, where and a country like Pakistan needs that concept of practitioner nurses, where we have still shortage of doctors available, especially in the peripheries areas where doctors are not available. Nurses can provide us with that opportunity. Islamabad Medical and Dental College created a nursing college. We do here BSN, Bachelor's of Nursing degree, which is a 4-year program, as well as post-RN, where the existing nurses come in and they do 2 years diploma and they get a post-RN diploma after 2 years. And the purpose of that is, one, to improve the nursing quality care at our own hospital and to have a better nurses there. Secondly, to provide to the industry too. And most importantly, which we view is our responsibility, is uplifting the nursing profession in Pakistan overall. So we not only working in developing and creating new and more nurses, we work towards and getting uplifting of the profession of nursing and getting it more respect. We want to attract better students into our nursing college, as good as we do on our MBBS and BDS. We pride ourselves on our MBBS students. We get students from all over Pakistan. We attract students from, and they come in and they perform incredibly. And we want to have the same standards for our nursing college as we do for our MBBS and BDS students.
And it would seem that the issue of nursing is something that is worldwide, because abroad as well you'll see nurses going on strike, saying that they're not being recognized for their efforts or the pay grade is too low. What are the common grievances that you see here in our part of the world?
One is the same. It's not. I think the nursing should have the same grade as doctors, because they are as important member of healthcare industry and healthcare spectrum.
Essential,
when we talk about healthcare spectrum, they are fully equal partners in that. You cannot have healthcare without nurses and paramedics. So we need to give them the same respect with them, same scale. And again, we need to update our curriculum We need to modernize that. We need to bring in the modern techniques. We need to bring in the concept of practitioner nursing here in Pakistan. And it's very essential for us to do that. And this is the grievances we do. It has been neglected for such a long time that it has become a profession of certain society, part of the society and all that. We need to make it attractive enough that equal number of males and female students are attractive, and every year there needs to be as much competition in getting into a nursing college as we do on an MBBS and BDS side.
So actually it's about lifting their spirits and giving them motivation for what, as we recognize as an essential part of healthcare.
Yes, it is. We have to uplift them. We have to bring more confidence. And what we do is we work on working. Most of the things we focus here is on their language and communication skills. And because if you have a good command on language and communication skills, you portray a certain kind of confidence, and you need to reflect. You can reflect yourself better, and you can present yourself better, and you can build your relationship better. I think with nursing, the challenge is not only the patient-nurse relationship, but nurse-doctor relationship also, which is very important to be recognized. The doctors have to recognize that they cannot operate without the nurses, and we need to build that kind of relationship. And that's why having the nursing college with the medical college help us build that relationship, because through our extracurricular activities, through our communication exercises, we do bring the two communities, two type of students together at the same platform.
No, that's fantastic. Thank you so much for bringing us here and
you.
talking to us about this side of the teaching hospital.
Thank you very much. It's a pleasure.
Mr. Niazi, thank you so much for showing us the Library Research Centre here. And I think you have a museum?
Yes, we do.
That is fabulous, and we would love to see that. So let's go there.
Please.
Okay, right now we're here at the museum, and it's sort of like it's reminding me of sort of like the Chamber of Horrors that we had in London. But of course, this is an essential part of the students' learning. Please tell us about the museum.
Museum is very essential part, because this is where we teach them the basics of the body, human body, and how it's made up, where it is, what are the organs are, how they operate, and what is their functionality is. The more they understand the human body, the better they will be able to know where the disease is, how it attacks it, and where it goes. So this is where basically majority of their work is done, led by our we have very highly notable faculty in anatomy on this, since we're working on that. But again, the thing is, now you have the models. This is also moving towards the virtuality. Now it's becoming more of a hologram and moving in, and we are trying to bring in the
Tell us about the virtual.
Yes, we are working on now developing our and bringing in what we call the hologram virtual body, a human body, where students will be able to dissect it, the body in 3D. Okay. And they can work with it as they want to do.
But because this will all be virtual?
This will all be virtual.
Oh, wow.
Because again, there is a limitation to when you work with real bodies. So that will give you the functionality and everything, or all the functions in the body and how they operate virtually, and that's where we are going in that direction. And very soon we will be introducing that.
So in what years is this introduced? As soon as they start?
This is the first and second year. Okay. For the first 2 years, this is what they study, because this is very essential, not only how the human body is made, but the physiology of the human body also, that how it works. This is how it's made and what it's made of. Physiology is how it works and how it goes. And then you have the biochemistry, what is the science and the chemicals behind it. So these are the three basic subjects which they teach for first 2 years.
Fantastic. Right, and as you said, this is such an important part of the students' learning. You were talking about the biochemistry and the
Physiology.
okay, and with this as well.
Yes.
Okay, right. Mr. Niazi, thank you so much. It has been an absolute pleasure being here today, and the content of today's program, I think, is just so important for people to understand the human side of medicine, of a hospital, and it's a fantastic vision. What's your short message for people who are watching the program today?
My short message will be the same message I gave at the start of it. Prevention is better than cure.
Yeah.
And we need to work towards our health, and we will need to work up. And then there will be another short message to our policymakers. Healthcare is a spectrum. We need to work on the whole spectrum, from health education to health delivery to the follow-up and the other systems, to give us provide full care to the patients, and we need to work towards it.
Thank you so much. A fantastic message as well.
Thank you.
And that's all we have time for, unfortunately, in today's program. We'll see you next week. Until then, stay happy, stay healthy. Bye-bye.
Thank you.